आगाज तेरे नाम से ऐ कारसाजे दो जहां, रहमत तेरी सबसे सिवा, तू सबसे बढ़कर मेहरबान. Dignitaries on the dais, dear yoke fellows, friends, colleagues, ladies and gentlemen. I am grateful to the organizers of the National Conference on Healthcare, Medicolegal Pulse 2025, Safeguarding Healthcare through Legal Excellence, who invited me as the guest of honor, and I am glad to be here with the SKIMS family, of which I have been a member for the last 4 decades. Education and health are fundamental pillars of a nation's development. Education equips citizens with the knowledge and skills necessary for economic productivity, innovation, and informed decision making. A healthy population is crucial for a productive workforce. Reducing healthcare costs and enhancing overall quality of life. Investment in these two areas fosters social progress, reduces inequality, and strengthens the nation's capacity to compete globally. Prioritizing education and health ensures a sustainable and prosperous future. Healthcare is the backbone of development. India has a growing population of nearly 1.5 billion, and for such a huge population, there is a need for a strong healthcare system. The country has one of the largest and diverse healthcare systems in the world. The total number of the hospitals in India is around 70,000, of which 26,000 are in public sector and 44,000 in the private sector. There are 30,000 PHCs, 5,600 CHCs, and over 1,000 district hospitals. The private sector contributes significantly to India's healthcare capacity. Nearly 62% of all facilities in India. While public hospitals serve a huge portion of the rural population, they often face shortages of staff, infrastructure, and resources. On the other hand, private hospitals provide better services but are expensive and least regulated. About 30% of India's hospitals are located in urban areas, serving a population that constitutes only 36% of the total population of the country. Many hospitals in India strive to meet international standards through accreditation processes, such as those from the NABH, ensuring that they adhere to strict quality benchmarks. Despite the comprehensive network of hospitals, the Indian healthcare system faces several challenges, which include quality versus quantity. While the number of the hospitals is promising, the quality of care in many facilities is inconsistent. Overcrowding. Many urban hospitals are overburdened leading to long waiting times and compromised patient care. Infrastructure issues. Many rural hospitals lack essential infrastructure, equipment, and trained staff, which can affect the level of care provided. The healthcare infrastructure is riddled with gaps. Only 20% of public healthcare facilities meet minimum essential standards in terms of infrastructure, human resource, and equipment. Despite some progress under initiatives like the National Health Mission, the disparity between rural and urban healthcare remains stark. India's healthcare expenditure is 2.1% of GDP, far short of National Health Policy of 2017 target of 2.4%. Global average is 10.87%, US 16.6%, Germany 12.7%, and surprisingly, Afghanistan 22%. India's healthcare system is vast and evolving, but it is also tangled in a web of legal complexities. The most pressing legal issues that shape the landscape include medico-legal negligence and malpractice, or we call it medical negligence. Rising litigation. Patients increasingly file complaints under the Consumer Protection Act 2019 for deficient services. Standard protocols. Lack of adherence to treatment standards, also known as evidence-based medicine, leads to legal vulnerability for practitioners. Data privacy and security. Digital vulnerabilities. With telemedicine and electronic health records booming, patient data is at risk. India's healthcare legal framework is a mix of progress and pitfalls. The legal issues in India's healthcare system do not just sit in courtrooms. They ripple through every layer of society, affecting patients, healthcare providers, and policymakers alike. Addressing India's healthcare legal challenges is about reimagining the system to be more ethical, inclusive, and innovation-friendly. India's recent healthcare legal reforms are laying the groundwork for a seismic shift, not just in how care is delivered, but in how it is governed, trusted, and sustained. Digital health ecosystem. Legal support for telemedicine and digital records will accelerate adoption of artificial intelligence, remote diagnostics, robotics, nanorobotics, and e-health platforms. This could bridge rural-urban divides and make healthcare more proactive and personalized. Tackling medico-legal issues in India is essential not just for justice, but for building a healthcare system that is ethical, efficient, and trusted. Improving the doctor-patient relationship in India isn't just about better communication. It is about rebuilding trust, empathy, and mutual respect in a system often strained by overcrowding, misinformation, and unmet expectations. It can be meaningfully strengthened to reduce conflict and prevent violence by promoting empathy and communication, training for doctors. 2. Transparent communication and shared decision making. 3. Effective grievance redressal system. It demands a cultural shift towards transparency, compassion, and accountability. There is a need to embed ethics in medical education. Tailoring medical ethics reforms for hospitals requires sensitivity to local realities, like cultural expectations, resource constraints, and systemic gaps. We have to train young doctors in ethics and communication, protect doctors while promoting accountability. Frequent strikes and service disruptions have eroded public confidence. There's a need to create safe grievance redressal systems for both patients and doctors, and enforce ethical conduct without punitive overreach. The greatest prophet, Muhammad sallallahu alaihi wasallam, emphasized high character and moral excellence as the foundation of a meaningful life and a just society. He said, I quote, "The best among you are those who have the best manners and character." He also said, I quote, "Allah loves that when one of you does something, you do it well." When professionals speak with clarity and compassion, they don't just treat illness, they heal people. In fact, over 80% of serious medical errors are linked to miscommunication between caregivers. It is a wake-up call. To address these critical issues, we need exceptional governance, focusing on accountability, transparency, and responsiveness. Professional management of healthcare institutions is crucial. Health professionals and administration should exhibit social responsibility during normal times and social responsiveness during difficult times. Concerns there, constraints here, challenges there, opportunities here. मंजिल से आगे बढ़कर मंजिल तलाश कर, मिल जाए तुझको दरिया तो समंदर तलाश कर. मंजिल से आगे बढ़कर मंजिल तलाश कर, मिल जाए तुझको दरिया तो समंदर तलाश कर. हर शीशा टूट जाता है, हर शीशा टूट जाता है पत्थर की चोट से. पत्थर ही टूट जाए वो शीशा तलाश कर. If we can't do it, who else will. God bless you. God bless SKIMS.